These are tricky times for different parts of our province. In the provincial capital, the national capital, and York and Peel regions, we're in modified stage 2. That's no gyms or bars or restaurants. But kids can go to school and people can attend dance classes. In the rest of Ontario, still in stage 3, bubbles aren't really still a thing if they included school-aged children, and no one can gather indoors in groups of more than 10 unless it's in a staffed banquet hall. Is that all clear? Well, it isn't for some, maybe for many. That's why we've convened a group of our own experts to explain whether it's the policy or the communications that have some Ontarians scratching their heads about COVID-19 protocols right now. So let's welcome, in Vancouver, British Columbia, Heidi Tworek, Associate Professor of International History and Public Policy at the University of British Columbia. And here in the provincial capital, in Harbour Village, Colin Furness, Infection Control Epidemiologist and an Assistant Professor at the Faculty of Information at the U of T, cross-appointed to the School of Public Health. In downtown Toronto, Amanda Galbraith, Principal at Navigator, formerly the Director of Communications to the current Mayor of Toronto. And in Leaside, Matt Gurney, National Post columnist and contributor to our own website, tvo.org. And it's great to have everybody on our program tonight. I want to just start by getting sort of 30 seconds from each of you, grading Ontario's communication strategy around COVID-19 right now. So give us sort of the banner headlines and then we'll go deeper. Amanda, start us off.
Of course, you're going to me first.
You're the communications guru.
Thank you for the title. Listen, I'd give them a B to a C, and I think probably part of the thing is we have a premier who I think has done quite well through this, and that he is inspiring empathy. People feel like he's fighting for them, but at the same time, we have, I think, a public medical officer of health and a medical system itself that's inherently contradictory. We've had public fights, and as you mentioned, there's some policies that are incredibly, frankly, they make no sense. So they're doing their best, but I think there's a lot of challenges that they're facing.
Colin Furness.
I give them somewhere between a D and an F. I agree that Premier Ford has done his best to appeal and to seem empathetic, but he doesn't understand the instructions he's giving. And we know that from Mother's Day, and we know that from instances since, that he can't actually make sense of it himself. And I think it's really hard to persuade people when you can't be clear about what it is you're trying to say.
Matt Gurney.
I would say a C and trending down. I think the communications were better earlier. I think ever since we started getting schools reopen again, we started talking about it, as you've already mentioned, bubbles and whatnot. The communications have fallen apart since then. And we're at the point where I'm someone who's engaged in this. It's my job to follow it along. I follow it out of personal and professional interest. Half the time, I have no idea if what I'm doing is what I'm supposed to be doing or not. So a muddled start and getting worse since.
Heidi Tworek.
So I'd say probably, I guess if I've got to grade as a professor, a C to a D, particularly in comparison to all the other countries that I've studied around the world and their communications. It can be clearer, it can be more effective. You could have one communicator. It is a massive problem if people who are engaged in this really have no idea what they're doing.
Well, Heidi, let me stick with you for a second here. Compare and contrast, if you would then, since you do examine how other countries and other jurisdictions are doing this. What do you like about what others are doing that you do not see happening here in Ontario?
Yeah, so a couple of things. One thing we saw in places like South Korea or New Zealand, for example, is there's a very clear split between the public health officials who are providing public health guidelines and then the politicians, only one usually, who's helping to make sense of exactly what's happening, so giving it a deeper kind of democratic meaning. And in Ontario, we see too many communicators sometimes contradicting each other. So that's one thing. Another is even simple things like the metaphors that are used to describe what's happening. We basically advise against military metaphors, which has been very heavily used by Premier Ford. Instead, we think things like, for example, a relay race, as South Korea talks about it, something that everybody has to engage in together. That's actually much more effective in motivating people to comply rather than this kind of authoritarian top-down messaging.
Amanda, do you agree it's a problem that we have the Premier offering advice, we have senior cabinet ministers offering advice, we have senior health officials on television every day, almost every day, offering advice? Is that problematic?
I would say any communicator I've talked to would think that politicians and in general people are overexposed on this, right? I mean, they've set up a paradigm where they're up every day. He's getting some electoral benefit out of that. But the real challenge here is that unlike, say, a BC where Dr. Bonnie Henry is, she's the de facto head of the public health for the province, you have 34 or 33 different chiefs all over the place, right? Who are contradicting each other, sometimes publicly fighting with the premier, as we saw with Eileen de Villa in Toronto, confusing the public greatly. So I think it is really, truly a challenge, yes, that there's not one unified message, but the system itself is set up so that can't even occur. So even if the government had the best communication strategy, they actually don't have the mechanism to deploy it.
Well, let me follow up with Colin on that, because when I think public health in the capital city, I think Eileen de Villa. I don't think of a bunch of other people. I think of her. When I think of public health at the provincial level, 6 or 7 or 8 names come to mind. Do you think that's a problem, Colin?
It's a huge problem. I sampled media communications, media coverage across Canada, and determined that in Ontario, it's 88% of the communication is coming from elected politicians. That's the highest in the country. Quebec is next. And so we do see a match between the mess that we have and the fact that politicians are trying to craft a message. I think public health always works best when it's conceived and implemented locally. I don't see a problem with having 34 different regional public health units. The problem is that they don't actually have the authority to make decisions. So we end up having public scrapping. We end up having Toronto having to beg for safety measures that we desperately need. And that is a huge problem. It turns this into political management instead of pandemic management.
Matt, is that to say that we should have had an equivalent of Bonnie Henry basically being the singular message carrier from day one?
That's actually a really interesting question. And that maybe we should have in a world where we can do that, but we don't live in that world. We live in a federation where we have a federal government with a prime minister who gave daily press conferences, with a federal public health authority who gave frequent press conferences. We have a province, obviously, as we've noted, with not only its own public health system, but with numerous people representing it. We also live in a province where we've had a lot of media consolidation in recent years. So a lot of the news Ontarians watch will come out of Toronto, where, they may be 100, 200 kilometers away, but they're watching local Toronto news, where local Toronto public health officials are coming out and making statements or giving orders that are relevant for the 416. Some of the issues that if you travel, again, 45 minutes, an hour by car outside of Toronto, you might have passed through 2 or 3 different public health regimes by the time you reach your final destination. If you're just a citizen, you're busy, you got your kids at home because the schools were closed last year, they're doing online learning this year, you're working from home, you're trying to do the responsible thing, you're trying to be informed and engaged, and you watch 3 different press conferences over the course of an afternoon, one from the feds, one from the province, one from the big city 2 hours away you don't even live in. I don't think it's any surprise that people are ending up confused.
Well, let me follow up on this issue of consistency of message. And let me preface it by saying this is not a show that intends to name and shame. That's not what we're about here. However, one can't help but notice that there have been a couple of very prominent examples this past week of politicians not necessarily modeling the best behavior in the midst of this pandemic. And I'll get our director, Shelton Osmond, if you would, to bring up this first picture here. This has obviously gone viral. This is Sam Osterhoff, who's a member of the Ontario Legislature from the Niagara Peninsula. He's the MPP for Niagara West. He's the parliamentary assistant to the Minister of Education. And he did come under a real torrent of criticism for a picture that he initially posted and then deleted earlier this week. Big group indoors, no physical distancing, nobody wearing masks, despite the fact that we're told that the staff at this event constantly told them to put masks on. The Premier, I guess understandably, given that he's a kid in his 20s, frankly, the Premier has said, he's young, he made a mistake, I'm not going to fire him, and I'm going to be forgiving. But I guess, Heidi, let's get into this here. What kind of message does it send when the people who are the decision makers aren't following the protocols of their own decisions?
This is an excellent question. And actually, we have a very good example of how harmful this can be in another place where I'm from, the United Kingdom, where Dominic Cummings, the special advisor to the Prime Minister, quite early in the summer was seen to be breaking some of the rules. And in fact, a study in The Lancet found that this had really undermined how much British people wanted to conform with the guidelines. They called this the Cummings effect, because people felt that it was one rule for politicians and elites and another rule for them. So I think we have to be very, very careful with situations like this. In other jurisdictions like New Zealand, for example, or Scotland, when leaders or health officials contravened the rules, they actually ended up resigning So there are examples in both directions, and I think we should be very cognizant of the fact that people are tired and they are frustrated. And if people in leadership positions are seen to be given different dispensations than other people, it will be very hard to get the population to continue to comply.
Yeah, Colin, I'm just wondering what signal you think it sends when the parliamentary assistant to the Minister of Education, I mean, if you're a teacher, if you're a caretaker in a school, if you're a student in a school, a principal, and you see the PA to the Minister of Education doing this, what message do you take from it?
I think it's really undermining, and my mind goes back to Mother's Day, the day after Mother's Day, when the Premier himself stood up and proudly announced how he had his extended family from multiple households to his house because they were all in the same immediate family tree. He didn't understand the difference between relationships and households, and he was flabbergasted. He wasn't sneaking around. He literally didn't understand the rules, and didn't actually apologize for it either. He just shrugged and said, oh, I got in some trouble for that. I think that was undermining, and that was back in May.
He's not the only one, Sam Osterhoff, to have done something perhaps ill-advised this past week, and we're going to show another picture here. The protocols are that when you're in an airport, you should keep your mask on. There's the Minister of Health, Patty Heidi, the federal Minister of Health, at Pearson Airport. Now, when she was asked about this, she said, well, I was just about to have some food and drink and therefore had to take my mask off. And some people have observed that there does not appear to be any food or drink in that picture. Okay, Amanda, problematic?
Yeah, to say the least, I think, for either of them, right? This to me, they're both bad, but this to me is brutal. She's the health minister trying to urge us all to publicly do this. And I think as part of that, especially when you're a politician, you know you've got to be better than just standard, right? You've got to go above and beyond. And yeah, maybe she took her mask off early before the food came, but that's not good enough. And we have to hold our elected officials to standard. People aren't seeing their families for months on end. We have parents, grandparents not seeing their grandkids. People losing their jobs, and elected officials are naming, shaming people all the time, calling them yahoos, saying COVID, like, all that kind of messaging to me just turns people off, and then this makes it worse.
Matt, do you have a little tender sweet spot for the transgressions of these politicians?
I don't. I do see some difference between them. For the federal health minister, obviously by virtue of her position and being a high public profile person, she ought to have known better. I mean, I think the health minister, by any standard, needs to be held to the maximum highest standard. For Mr. Oosterhoff, perhaps not quite as high a standard, but the optics of the photo were just so egregiously terrible. I'm not seeing my parents right now. I'm not seeing my grandmother because my kids are in school and I don't know what they're exposed to there. To see a whole family reunion, even though, again, I don't hold them to as high as standard, it just felt like much more of a knife twist than what I'd seen with the federal health minister.
Now, Heidi, you gave us the example from the United Kingdom. We don't seem on this continent anyway, to, ministerial resignations are pretty bloody rare these days. But do you think these transgressions warrant resignations by either of these politicians?
Oh, it's a tough question. I mean, in some cases, it was multiple transgressions, but I think it just also spoke to places that really wanted to hold their leaders to the highest standards and to have examples for the population. So this was just one of many different ways in which, for example, New Zealand's communication was so incredibly strong. So I think it's always tricky to say from another context, X should resign or Y should resign. But one other thing to add is that places where politicians admitted mistakes and apologized actually ended up with increased trust. So the Norwegian Prime Minister Erna Solberg said at some point in the summer, she regretted that she had done such a strict lockdown. It turned out that wasn't necessary. And admitting that mistake actually ended up strengthening Norwegians' trust in her. So I think that's also something that we can take away. Admitting mistakes is not a bad thing, it can really increase trust, and so can apologizing. Sort of basic things we all learn at 5 years old in primary school.
I would like to ask Colin about something that may or may not happen 3 days from now. We have been told that masks, physical distancing, and of course being outdoors are ways to help reduce the spread of COVID-19. Halloween, you would think, would check off all of those boxes, and yet the last we heard, Halloween is sort of being canceled this year in the province of Ontario, at least in the areas where we're in modified stage 2. Do you think that's the right call?
I think it was a heartbreaking call. I am really saddened by that, not only as a parent, but also because I was one spending months pleading with the province to close restaurants and bars on the basis of evidence. And they kept saying, we don't have enough data yet. and Halloween is canceled with absolutely no data whatsoever. I think that's dispiriting and disheartening precisely at a time where we all could use a sign of resilience, where we could all use a little bit of joy and have a project to actually work on in terms of how to do this safely. That would have brought people together, and I think it was a giant mistake.
Matt, you've got kids, yes?
I do, and they're exactly the age where losing Halloween is the worst possible thing they can imagine. They were asking months ago, will Halloween be back? We've improvised something with other families in the neighborhood, families where we're already exposed to them because our kids are in the same class. So we feel as though we can pull something off. We'll do a scavenger hunt. They'll be out in their costumes, so they will get a Halloween experience this year. But I'd mentioned to your producer before, Steve, I live in a neighborhood that tends to go a little bonkers for Halloween. Like the decorations are always crazy. People drive through our neighborhood to look at it. You're not seeing much of that this year, and I think you're seeing some of it, but I think there's just a reflection on the behalf of my neighbors. I don't know them, but I drive by a house, I'm like, oh, these guys normally by now would have their huge inflatable whatever set up, and it's not there this year. It's like putting out a sign saying, hey, we're open for business, and this year we're not seeing those signs.
Heidi, I have no doubt but that if people were literally dropping like flies in the streets, the public would completely understand that Halloween has to be canceled. But since that's not happening, do you think that governments have adequately made the case that Halloween needs to be canceled because things are just a little too much on the precipice?
So I think I'd take a step back and say this is a trap that Ontario sort of set for itself, right? By always issuing very, very granular guidelines for every single holiday, they make people now expect that they're going to be told, should I do Halloween? How should I do it? You know, we saw this with Thanksgiving. And another approach is to say, look, the virus doesn't take a holiday. You know, it's not like diets where you can have a cheat day. In fact, you know, you have to conceive of your Halloween activities in the same way as you would any other activity. And if you can find a way to do that safely, outdoors, for example, then that's one way of doing it. And I think that's where the example of BC is very helpful. There are guidelines. People don't sort of hang on the word of what to do for Halloween or Thanksgiving as much because they recognize if you're going to do an event, you have to do it within the parameters of the usual guidelines. And so that, I think, more broadly is a communications reset that would be incredibly helpful.
So, Amanda, help us understand then what the communication strategy ought to have been here. If you've decided as a government that doing Halloween is simply too dangerous for the young people and maybe the parents and grandparents that they potentially could infect, have they adequately, in your view, made the case that would convince people that Halloween needed to be canceled?
No, I actually think this, like from a policy perspective, is an idiotic decision. I'm not going to play armchair doctor here, but in far as communicating it, also it's this attitude now because they don't have the data to back it up, right? It's just do as we say because we know better. And I think the public is turning off of that. They're frustrated. They don't understand because the rules are so contradictory. Sammy Oosterhoff can go to a banquet hall and you know, party with 50 people, but my kids can't go trick-or-treating safely outside when they're masked. So I think the way they communicated this, frankly, I was not a fan of it. I thought the graphics that they put out were ridiculous and also quite tone deaf. And I think they turned off a lot of the public and parents who have tried to be patient, because if we can't manage an outdoor event that's masked while people are staying in their family units, how are we going to manage Christmas? How are we going to manage, you know, the next year? Because this is not going away. And right now we don't have a sustainable, this is how we're planning to live our lives for the next year. We make decisions 1 week at a time. And I think people are just tuning out and doing what they want to do.
Colin, obviously in this job, I get lots of emails and phone calls from people asking me questions and telling me their experiences. And I'll just repeat one that I have heard probably more than any other one recently, and then get you to weigh in on this. Once upon a time when the province reopened gymnasiums, hockey rinks, fitness facilities, they did not require mask use, and then we had outbreaks, and then they shut everything down. Well, in the 4 jurisdictions where we've gone to modified stage 2. But then they reopened dance studios. And of course, schools are still open with 30 kids in a class where there are 30 desks, and you know, they're not 2 meters apart. But movie theaters are shut down where even if 10 people are in a cinema of 250 seats, that's unacceptable. Can you please make sense of all of that for us?
Nobody can make sense of that. There's too much internal inconsistency. There ought to have been one simple rule applied starting from Labor Day, if not earlier, which is unless you live in the same household, you do not be indoors with anyone without a mask. Full stop. And for situations where you might be in a larger place with people for some period of time, then we need to work out guidelines for that. For example, movie theaters. But the way the rules have been announced and enacted, not based on evidence at all, not based on emerging evidence, and not explained to people. So no, I'm afraid I cannot make sense of those.
Heidi, do you see either simplicity or consistency in any of those decisions from the province of Ontario?
Not really, to be honest. I mean, it's a massive problem that people can't understand the guiding philosophy behind why some things are open and shut.
Matt, how about you?
I've written a column about this for tvo.org where I talked about the emails I get from all the various extracurricular or athletic activities my kids are involved in. Not only can I make sense of it, the people who have to make sense of it can't make sense of it. One example I noted was that my 8-year-old daughter went to a gymnastics program that was indoors, and they were shut down when we went to modified stage 2. But it took about a week for the owners of the gymnastics studio to figure out if they, under the law, were a gym, which is the root, which is adapted from gymnastics, or if they were an indoor recreation facility. And depending on which one they were legally, different rules and conditions would have applied. And it took them about a week to figure this out. I was getting constant, almost daily emails from them going, we don't know if we're open. We don't know if we're open. And they eventually decided that they were not open. They eventually did close down. But if you have good faith efforts by business owners and facility operators to figure out what the rules are, and it needs 7 to 10 days and meetings with city officials and their local MPPs to do it, that's a sign of a system that is simply not working.
The top doc in this province is David Williams. He's the Chief Medical Officer of Health for the province of Ontario. Let's listen to a little bit of something he recently had to say about these issues. Sheldon, if you would.
In the first wave, when they did case contact management, they had an average of 10 to 12 people that were contacts of the case. Now they say it's quite common to have 50 to 60 to 70, even up to 100 of a case. That's saying the last 5 to 7 days you were in close contact with. And my thinking is, I don't understand that. Why would you have that kind of thing? What did you not understand about our messaging? And if you get a sense, there's somewhat of frustration, because to me the messaging has been said and said again. It's so clear, it's obvious.
Amanda, the messaging is so clear, it's obvious. As a communication strategy, would you recommend that to a client?
No. And, I'm sure I know Dr. David Williams is working very hard behind the scenes, as all the people there are. But I think, anyone who's watched his press conferences, and I've watched more than a few, would admit that communications is not his strong suit. And I think that's one of the big problems here is we get clips like this, which are, there's the gif of Julia Roberts looking at the ceiling trying to figure out what math equations going around. I cannot make head or tail of what he says half the time. And part of what happens then is that then shifts the burden of communication onto the politicians, who are driven by the whims of different regions and different electoral districts. And of course, I think politicians have a role to play in making these calls, but not to have a strong person to be able to communicate with you from a medical perspective, I think is really hurting us as a province. And it's forcing a lot of this on political actors who frankly aren't equipped to make these kind of calls either.
Colin, what's your view of Dr. Williams' communication abilities?
I think his poor communication isn't the problem, it's a symptom of the problem. I don't think he understands public health the way we need him to. He doesn't seem to understand testing strategy. He definitely doesn't understand social network theory and bubbling. His recommendations run counter to first principles and common sense so often that it would be impossible for anyone, I think, to explain that really clearly. Since July, I've been asking him to vacate his office. He is not up to the job based on the experience and expertise he does not have.
Okay, let's, Sheldon, can I ask you for a 4-shot here? Can we see all the guests at once? Can I see a show? Okay, Colin has gone on the record here, as he has for many months. Can I see a show of hands? How many people think the Medical Officer of Health for the province of Ontario ought to be replaced immediately? Hands up, please. Okay, Colin's got a hand up. I see Heidi is on the fence. The other two are not. Matt, how come you're not calling for his resignation?
I'm not convinced there's anyone better to replace him with at this time. If you look coast to coast across this country, we've had 2 standout public health officers in BC and Alberta, and in the second wave, both those provinces are struggling. They did fairly well in the first wave. They're taking it on the chin this wave. If I was confident there was someone better waiting in the wings that we could, yank Dr. Williams, send him off to a well-earned retirement, and put in someone new, I would do it. Like, you know me, Steve. I don't mind firing a hockey coach if the season's not going the way it needs to. I don't mind doing that at all. But I would need to be convinced that that would lead to an upgrade. And I would think right now there is absolutely a very real chance that it would take a bad situation and make it worse. I don't assume the problems in Ontario right now are the result of Dr. Williams, and I do not assume that removing him would immediately make any improvement. We're in the middle of a second wave right now, and sometimes you go to war with the soldiers you have, not the ones you want. And for better or worse, here we are. We're in this thing.
Heidi, you sort of put your hands up as if to say, I'm sort of on the fence about this one. Why were you not categorical in your willingness to dismiss Dr. Williams?
So I think it's always tempting to focus on a single person and not to think about structures, as Amanda pointed out. So one way to think about this is it's also possible to just do a reset of your communications and say, okay, we really need to sort of rethink this. It's clearly not going as well as we hoped. Who can we appoint as the top 1 or 2 communicators who can very clearly explain things and let some people inevitably then take a step back? In South Korea, for example, one of the top doctors, she actually communicated by not communicating. So she said, I'm simply too busy dealing with this crisis to actually do anything other than occasional single press conferences. So there are ways of communicating that don't involve sitting in front of the press, appointing someone who's actually really skilled in communication to bring those messages forward. And I'd also add, put them on social media and meet people where they're at, which I think has been a bit of a weakness in much of the communication across Canada.
Colin, at the Premier's daily briefing, he is frequently asked about whether or not he still has confidence in Dr. Williams, and he goes to the wall for Dr. Williams. He says, not only do I have confidence in him, but I think the expression he uses is, Dr. Williams is working his back off. I call him at all hours of the day and night. He is there. He is offering good advice. If the Premier has confidence in him, should that be good enough for the rest of us?
I think the Premier is the only person I've heard defending his conduct and his capacity. I don't think this is a communications problem. I think it's a competence problem. I think it's a decision-making problem. And again, if you're making bad decisions, there's no effective way to communicate that to make things work. I think he's been effective for the Premier because this has been handled as a political problem in Ontario. And you don't want a strong public health leader if you're determined to manage this like a political problem. This is why there's no advanced planning. This is why the decision-making really doesn't make sense when you're trying to keep people safe. So I can completely understand why the Premier has full confidence in him, but I do believe he's the only one who does.
Okay, in our last couple of minutes here, Matt, let me ask you, a year ago, if we were having this conversation, first of all, we wouldn't be talking about COVID, but we would be talking about how terrible the Premier's polling numbers were. A year later, he's one of the most popular premiers in the entire country. Can he not say, look at Matt Gurney, you may not like where things are at right now, but the public seems to have confidence in me, and I've got confidence in David Williams, so back off a little bit, Buster.
Well, he can say that. How many people will listen to him? I suppose we would have to, we'd find out. What I would say is this, and I actually do find that a fascinating question. I was talking recently with friends who I had over at my house for a dinner party on New Year's Eve. Doesn't seem that long ago. In objective adult terms, it wasn't that long ago. All of the things we were doing, we would not do. I had people from 6 different households under my roof. There was no masking. Like, the world changed on us very quickly, and it was obviously to the benefit of Mr. Ford. We as Canadians have the danger we always do is that we will get so mesmerized by what's happening south of the border, it will be almost impossible for us to have an objective measurement of how we are doing. So right now, as long as the United States continues to struggle, any Canadian politician is going to look good almost by default. When we broaden that out to an international reckoning, obviously Canada doesn't look as good. We are not the worst, but we are certainly not the best. And even within Canada, like I said before, in the first wave, Ontario and Quebec struggled. The second wave looks more complicated. So Doug Ford, whatever you think of him, I think he has a defense to make, even if it is that other people are doing just as badly.
And Amanda, if you were able to get yourself in a room with Doug Ford right now, sit down with him and his chief of staff and maybe his top health people, health policy advisors, give them one piece of advice that you think he, notwithstanding how well he's doing in the polls, that you think he ought to be changing up to do even better.
I think if I were them, I'd focus on testing and communicating that we are moving forward with that. I think they need to set clear parameters. Like, the problem is that we don't have clear parameters of how to make decisions. So instead we look to the government to decide if we can cancel Halloween or Thanksgiving or Mother's Day. If they set a clear set of guidelines that say, if, you know, for example, don't be in groups above 10. If you're with people that aren't in your house, you must wear a mask. And that's where people can actually logically apply their own lens to it. Then you get out of this constant, you know, cut and thrust and push and pull from the public around, you know, these heart-wrenching issues of family. So I think that's where they have to get eventually. I would also suggest they pull back from the daily press conferences, but my bet is that's not going to happen for a very long time.
They can't resist their close-up, Mr. DeMille. Anyway, that's an old reference to an old movie that's goes way before your time, Amanda. But there we go.
I remember it though.
Good for you. Good for you. That's Amanda Galbraith. I want to thank Matt Gurney, Colin Furness, Heidi Tworek. It's great of all of you to join us on TVO tonight. Thanks so much.
Thank you.
Thank you.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.